Dr. Myers, we're live now.
Good evening, and we're back for one of our COVID conversations in the Black and Brown communities. Today, I am so excited for our show where we'll be talking about the little people. Yes. So as usual, my guest, Dr. Maya Williams and I, we welcome you. And we'll get started by reviewing what's been going on. So we haven't seen you guys in a little while because we needed to take a break for the summer to get our minds refreshed and clear. So we're going to focus on back to school. As you well know, Dr. Maya Williams and myself are your hosts. And where are we now with COVID? Well, at this point, our numbers unfortunately have started to go back up again. We've seen, especially in places such as Alabama, Florida, Texas, where the numbers are just through the roof. Currently, we have almost 40 million cases of COVID, and the 7-day case per 100,000 is as high as 274. And we have unfortunately lost over 600,000 Americans to this disease. When we look at rates of vaccination, we can see that they have growingly increased from where we were earlier this year. So nearly 500 million have been delivered, nearly 360 million have been administered, and roughly about 60% of our population has gotten in at least one dose. Obviously, we were trying to get there by July 4th. That was President Biden's hope, but we did not make it. And roughly 169.2 million people have been fully vaccinated. Here in New York City, we're doing pretty well. There was actually an article not too long in the New York Times where they said that Black folks ages 18 to 44 were not getting vaccinated. I have my own theories about that, but that did come out last week in the New York Times, but I don't know how accurate that really was, because I know a lot of Black folks in that demographic who have been vaccinated. And what is the problem? The problem is we're dealing with the Delta variant. So the previous variants that we had, Alpha and Beta, were not nearly as contagious as Delta. So when we had the original strain, which hit the US, which was Alpha, maybe 2 people would have been infected if they came in contact with you. Whereas Delta variant, we're seeing anywhere from 5 to 8 people are potentially being infected. And so the fact that it's highly contagious in smaller droplets is what's making it ravage the United States, as we've unfortunately seen in India. Unvaccinated people are the greatest concern. And unfortunately, we are seeing some cases of breakthrough infections. I know at our hospital, most of the patients who have breakthrough infections tend to be either elderly or people with underlying immunocompromising conditions, not usually our healthy folks. The greatest risk, of course, is amongst our unvaccinated people, because they're most likely to get it as well as transmit it. And so we have to continue to be careful and to wear masks, whether we're indoors or outdoors, because you never know who's vaccinated or not. And there's also concerns about the efficacy about the vaccines. I read one study not too long ago where they said that the Pfizer vaccine is about 42% effective and Moderna is about 65% effective against the Delta variant. What about COVID and children? So we know that the cases of COVID in children are rising greatly in the United States. About 7% of cases are now in children. About 1% of hospitalizations are amongst children. Luckily, only less than 1% are leading to deaths. We've seen again in places in the Southeast, like Florida, Texas, Louisiana, where I read that there was actually 1 in 4 children have tested positive for COVID, which is insane. As of late July, the number of children who made up COVID, again, was about 7%. And children accounted for roughly 15% of all newly reported cases of COVID-19 across the nation for the week ending on August 5th. Nearly 94,000 child cases of COVID-19 were recorded during that period, a 31% increase over the roughly 72,000 cases reported the week earlier. And the number of children hospitalized during the week of August 14th was at a record high of just over 1,900. It grew by 31%. And what's happening with our kids? So children are developing what's called multi-system inflammatory syndrome in children, otherwise known as MIS-C. Although it appears to be rare and can show up a few weeks later, it can cause some symptoms such as issues with the heart, your lungs, kidneys, brain, skin, eyes, or GI tract, which can present as fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or feeling extra tired. And most children will only have a mild illness, but some children will have much more serious illness. And recently, researchers at Mount Sinai have found that there was a specific network of genes expressed at the lower level in children with this condition that pointed towards the cells that are impacting the immune system of these children. And those are the cells that you normally would have that can fight the infection. It's not that they stop working. The problem is not that they don't work. The problem is that they keep working when they should stop. So it sounds like it's almost like a kind of autoimmune condition that's going on. So when we talk about the vaccine with children, we know that Pfizer is approved in children who are 12 and over. Moderna was putting in for approval for adolescents as well. The CDC recommends that all children over the age of 12 should be vaccinated to help protect against COVID-19. And they're showing that the vaccination rates among children ages 12 to 15 have been slowing, and they are reporting the lowest coverage of any age group, despite the recommendations from the CDC. As of July 26, more than 5.6 million 12 to 15-year-olds and 3.6 million 16 to 17-year-olds had received at least one vaccine dose, which is approximately 37 and 48% of the adolescents in each age group, respectively. And then if we look here, we can see the breakdown by race and ethnicity amongst various states, where we see that white and Asian children are tending to be more vaccinated in some places, but in some places its vaccination is low, like such as Kansas. So every state is different. And in Washington, D.C., we can see the large discrepancy amongst children who are either white, Black, or Hispanic. So what are we doing about going back to school? So as we know, there's certain states such as Florida and Texas where mask mandates are not being enacted because of the governor's strict laws that they cannot be enacted. And unfortunately, despite the fact that this Delta variant is more transmissible, these mask mandates are not being enacted throughout the country. And classrooms have already started open and they've already started to close because kids are having breakouts in their local school. And remote learning, unfortunately, is not always an option. And for many children of color, they've been set back due to maybe areas of low Wi-Fi, inability to access computers and other technology that's needed, or just not having it as an option at their school. And then, of course, you know, people of color with sometimes childcare issues and access to getting to alternative sites of learning. They also may not have access to the free or reduced meals like free breakfast programs, free lunch, and all this obviously has taken a toll on the mental health of children. For example, the New York Civil Liberties published a top-line analysis and the full data sets from the New York State Education Department's statewide survey of school districts at the end of 2020. The survey revealed that in New York, that more than 215,000 students, which is 8% that were included in the survey, lacked devices, and more than 165,000 students, 6%, lacked sufficient internet access. More than the 2.6 million students who were represented in the survey results. This is pretty unfortunate. And even though we know that schools have not been necessarily super spreader events, they still have been areas and places of spreading of COVID disease. And so again, this has an impact on children's mental health. We know that anxiety, depression, sleep issues, withdrawing from the family, and aggressive behavior have all gone up during the pandemic. There has been studies that have shown that 1 in 4 youth around the globe are grappling with clinical elevated symptoms of depression, and 1 in 5 have increased rates of anxiety. And of course, we know that mental health is looked differently. So in communities of color, our children tend to have schizophrenia, where in non-communities of color, they're quick to say it's bipolar. And we know that poor Simone Biles was ostracized, as well as Naomi Osaka, because they were talking about the toll that the media and the pressure of being their best has taken on their mental health in regards to depression and anxiety. And Simone Biles and Naomi Osaka have definitely shown that they can be wonderful role models in addressing the fact that we need to discuss mental illness and that it affects our communities of color as other persons. In fact, the rate of suicide attempts for Black adolescents rose 73% from 1991 to 2017. And in another study of Hispanic Latinx youth aged 10 to 14 in the United States, the findings suggested that they experienced higher amounts of mental health issues prior to the pandemic, and interestingly enough, experienced a decline during the pandemic. So now let's focus on saying thank you to some people that made this all possible. So we would like to thank our sponsor, the Long Island Children's Museum. We also want to thank the following people listed here on the slide for their continued support of our show and for what they do to make sure that we have this wonderful programming. Also, please follow us on Twitter at Minority Health 3 and on Instagram at minorityhealth.combos. So today we have three esteemed panelists. We first have new mom Janae Howell, who is serving as a school psychologist at the R.N. Willent School. She's a non-traditional school psychologist who is currently working on her PsyD in school psychology at Adelphi. We also have Marlon Lewison, who also is a PsyD candidate in school psychology at Adelphi University. He has been focusing on diversity of students in schools, as well as education reform and how schools climate affects one's true self, false sense conceptualization. And last but not least, we have Dr. Lewis Hart III, who's the medical director of health equity at the Yale New Haven system. He did his undergrad at Vanderbilt and completed his medical school training at the University of California, San Diego in medicine. And he is currently the inaugural medical director of health equity at Yale. So we look forward to all of you sharing so much wonderful information. And I will turn the show over to my co-host, Dr. Maya Williams.
Thank you, Dr. Myers. First question will be for Lou. Initially, we were told that kids are not affected by the virus at the same rate as adults. However, new state level data analyzed by the American Pediatric Association show that 15% of all COVID-19 cases are in children. For the week ending August 5th, nearly 94,000 child cases of COVID-19 were recorded. During that period, a 31% increase over the roughly 72,000 cases reported a week earlier. In the week before then, there were 39,000 new child cases. Why are the cases rising so fast in children? And how safe is it for children to go to school with these rising cases?
It's a great question to get us started off tonight. I think it's obviously multifactorial. There's a lot of things at play with the reasons that kids or the rate of infection is rising across the platform, and kids are also being affected by that as well. As discussed by Dr. Myers, the Delta variant is just far more contagious to begin with. And you put that on top of a society that has a little bit of mask fatigue, that definitely has distance fatigue. And as people started to get vaccinated, people started to get out of their homes and start to go back out and try to live a semblance of what they remember as normal. And all those things we know are activities that allow viruses to spread. We're all aware that viruses, we've lived with viruses since there have been, humans on this planet. Viruses predate us and they'll long live past us. And I think the idea is that when it comes to COVID-19, it's not that it affects children differently, it's that it affects all of us. But with children, they tend to be, I think at the start of the pandemic, children were more asymptomatic from alpha and beta variants, and we weren't testing children. So it's hard to know whether they were more asymptomatic cases amongst children at the start compared to what the rising numbers now, where testing is universally available and much more accessible than it was prior, at least in the spring of 2020. So I think, that is playing a key difference as well. In terms of, the fact that Delta variant is just far more contagious absolutely contributes to this. But I think the thing that we have to be very reassured is that for the majority of children who do get sick with COVID-19, compared to their adult counterparts, they do much better. Very few kids are hospitalized and very few kids get so sick that require ICU level care, which I wish I could say of all my adult colleagues who are in different parts of the hospital, taking care of far different patient populations and far sicker patients when they do get COVID. So I think that's very important for us to understand. I also think that, unfortunately, masking has been very politicized, but from everything that we see, masks, they really work. Yes, they're annoying. Yes, they're goofy. Yes, we're all sick of them. But the silly thing is they work and they seem to limit the spread of other viruses, because as a pediatrician, I actually got redeployed to adult medicine during COVID because there were just no kids getting sick with routine cold viruses, routine flu viruses that have babies end up being in the hospital for weeks on end with breathing difficulties. Because everyone was masking and everyone was social distancing, kids weren't getting those type of illnesses. So we know that masks work for every other virus. It would only stand to reason, and obviously this is anecdotal, it would only stand to reason that they do work very effectively for COVID as well. So I think we have to understand that, yes, we're all sick of masking. Yes, we're all sick of, taking the precautions, but these are the things that are going to get us over this. And the longer it takes for us to put COVID behind us, the more people will continue to affect. And the next variant, I don't want to be doing this again now, the Echo or the Foxtrot variant are out, and we're talking about something completely different. It's going to take all of us to get through this together, and we're only going to be able to get through it when we all get vaccinated and we all start to, hold ourselves personally accountable to limiting that spread. And that's, ensuring that we wear a mask when we're in crowded places or indoors, and ensuring that we're taking every precaution that we can to ensure that if we ever are ill, we get tested right away and we quarantine ourselves, or that we just don't really, engage in high risk activities. But obviously, we have to have a balance, because the toll that's happened to kids through mental health and the lack of socialization, the lack of being a kid, is probably far worse than what we've seen in terms of their clinical outcomes with COVID-19. So I don't think we can close schools down again. I think that would cause far more harm than the benefit of potentially limiting spreads of COVID-19. Yes, social distancing worked. Yes, if we all stayed in our homes and didn't go out, maybe COVID would go away, but that's impossible to do. And the consequences or the risks of doing that probably outweigh the benefits. So we need to find a middle ground where we do take a little bit of risk, just like getting in our cars every day, a very risky activity, but we appreciate the benefit of getting to work, not 2 days later, but within 20 minutes, because we can drive fast. So we have to look at COVID the same way. Hundreds of thousands of Americans die of the flu every year, but I've never heard of anybody taking time off of school before the flu unless they got sick themselves. So we have to understand that we have to live with this virus. And if we want to make sure that it limits the way that it affects us, we need to adapt a little bit and start to, model those high or those really safe behaviors by wearing a mask when we're in public, wearing a mask when we're indoors, and obviously trying to just limit the spread as much as we can. But I definitely don't think we should be in a position where it has to be all or the other. It has to be, 100% or zero. There has to be some middle ground here that we can all find acceptable that will help us get to the other side of this.
Thank you very much. And you give us a lot of information about masking, and masking is very important. And so I want to turn this question over to Janea and Marlon. Now that we have schools opening in some parts of America, they are already open, but in New York City and New Jersey, I believe it's a little bit delayed. I'm not sure, but many teachers, school counselors, and other educational personnel are afraid to return to school because there's so much polarization around mask mandates and vaccinations. What steps are the relevant authorities in the New York area, including New Jersey, taking to protect students and educators who are returning to the classrooms this fall?
I guess I can go ahead and get started and speak for my own personal experience. So I'm currently working in a district in Perth Amboy, New Jersey. And so right now we still have our mask mandate in effect. And there are still also distancing guidelines and spacing in terms of when we're in the classroom, how close we can be and what resources are available in the classroom. So certain items that we used to share and were manipulatives that we could all use, those are not being used right now, so that we can make sure that we are trying to be as clean as possible and keeping that distance to keep ourselves safe. I think what's important is things keep changing. So we may get information, this week or at this moment, and it says one thing. And then when we start, September 7th, it's going to say something different. So making sure that you are following your emails or watching the news to make sure you're staying updated on what your school district is doing and what procedures they're following. And then kind of, I think also having an attitude where you're ready to kind of roll with whatever you get, kind of, because I know it can be frustrating if you think, oh, we're going in this way and it's going to change. We know change is a part of life. So to know what you feel comfortable with, and that's what you're going to stick with, and just being prepared to get the proper information when it is that day to start school. But as of right now, I can speak for my district. They are still keeping that mask mandate. And I know myself, even one of the personal decisions I made was that even if that was a decision my district took away, was to not use masks, so said we didn't have to, I personally felt I was still going to be wearing my mask in the school building. So we always have those options as well.
Yeah, much to Janae's point, I could speak on behalf of New York City just off my personal experience. I just finished my internship at a non-public school setting in Brooklyn. And I started off in person. I mean, I did 1 day remote throughout the year. As you could imagine, it was rather scary, and there were a lot of questions this exact same time last year. Are the mask mandates enough for me to prevent getting COVID? Is it enough for the children? You know, I think some of us had assumptions of working with neurodiverse students, whether or not that might have been a concern, and we might have saw more of an uptick. And truth be told, since I want to say since maybe February or March, we didn't have any positive cases. I mean, we all took a really important initiative in wearing our masks, being socially distant. We had, you know, as time passed, more students and more faculty members were coming into the building. I know, even though I just finished my internship there, as it stands, moving into the next school year, they're moving to all in-person model. And just like Janaea said, I mean, right now, it probably could change. You know, I could get a call from one of my colleagues in 2 weeks saying, you know, psych, you know, that's not really what we plan on doing. And I think what's really important is to, you know, just make sure that we're following the health and safety guidelines, you know, staying abreast of what the CDC is saying. You know, as far as New York State right now, there is mask mandates within the schools and also within public settings such as restaurants. And some of the, similar to what Janaea said, even if it wasn't, I'd still keep my mask on.
Thank you very much. And so masking is so important. And in addition to masking, we should always continue as much as possible, try to social distance, as well as wash our hands as often as possible. The next question is for Lou. While COVID-19 causes mild illness in most children, some children do have some more severe illnesses requiring hospitalization for treatment of COVID-19, pneumonia, and multi-system inflammatory syndrome in children, or MIS-C. How does COVID-19 affect children? What is MIS-C, and how does long COVID present in children?
So another great question, and something that, you know, we're very fortunate that this disease had a little bit of a disparity in terms of the ages that it affected. I think that, you know, it's unfortunate that it had to affect any Americans, but at least it didn't have a large burden on children's physical health, though the mental health that the mental dishealth that occurred through social distancing and the necessary requirements to limit the spread also did have a physical impact on kids' health. But in terms of how COVID-19 usually presents in children, it can come from very similar to presentations in adults, where it could be a mild flu-like symptom. They could remain completely asymptomatic, to potentially a more severe course in a far minority of children, where the 99% of the time they are not in the hospital. They are not hospitalized for this illness. They might have a fever, they might have some diarrhea, they might develop a rash. These usually go away within a couple of days, and they make full recoveries as far as we know it. Unfortunately for some, though, it seems, and it has a lot to do with, like Dr. Myers was saying, the immune system and genetics that we're just beginning to understand. Some people's immune system seems to be more active and almost seems to be too good at its job. It not only fights off the COVID so well that there's actually still immune system left that starts hurting the body. It's almost like an innocent bystander in a war. So the body actually becomes too sensitive and overreacts to the COVID virus. After conquering the COVID virus, it then can potentially start to impact the lungs, or which we know is COVID pneumonia, or it can actually start to cause what we call MIS-C, which is exactly like it's almost like an autoimmune disease in children. And we see other very similar, almost identical disease that we've known for a long time, known as Kawasaki's disease. This was the disease first discovered in Japanese youth, thus the name, by a physician, but it's a very similar, which is likely preceded by a virus. And it's just the body's overreaction, usually a couple weeks later, to an earlier viral infection. We see a rash. We see kind of multi-system involvement of inflammation. So their heart might become inflamed. They might have diarrhea. They might have a rash. They might have difficulty breathing. And, you know, kids who have MIS-C can get very ill. Again, we're talking percentages of 1% of kids who ever get that sick, thankfully. But, you know, they do require ICU care. I've taken care of a few kids who have battled MIS-C. They tend to make complete recoveries, but it is very harrowing times, not only for the kids, but for their families. So it's something that we've fortunately seen before. It's unfortunate that we have to see it again, but it's something that the treatments that we use for Kawasaki's disease kids nowadays with MIS-C seem to respond very well. And again, we used to see much more Kawasaki's disease than we see MIS-C. And ironically, we don't see that much, or we're not diagnosing Kawasaki's disease nowadays. We're calling it MIS-C. So how much of a crossover and how much is there still left for us to learn about viruses and their long-lasting impacts? When you ask a question about long COVID, I think the jury's still out. I mean, I think we're still trying to figure out what long COVID, or, you know, chronic symptoms of COVID mean in adults. I know my mom, literally, she got COVID. We were in New York City. She got COVID March of 2020, so early in the pandemic. And for a month, she had flu-like symptoms. She was sick, never had to go to the hospital, never had breathing symptoms that needed oxygen, but she was sick. And a year, 18 months later, she still can't really taste or smell. She has headaches, she has fatigue. And she's young, she works out every day, she's very fit. So obviously this is really debilitating for her, but she's trying to take a glass half full approach. But in terms of kids, we tend to see less of these long lasting sequelae. But I think, there's long COVID from getting the infection, but then there's also long COVID, the chronic stress and burden that places on all of our mental health that I think needs to be valued just the same way. As you see in those charts, this is not just what it does on your diagnosable physical health. There are so many consequences that we're only beginning to peel away the layers of the onion on how kids have been affected in school, on how kids have been affected by being at home with parents that have been out of work or have been having difficulties providing for their families because of the social and structural barriers that have long predated COVID, but that COVID ripped a Band-Aid off of. So I think that it's a multifaceted question. For the most part, kids stay well. But those who do get sick, it looks a lot like an earlier condition that we know how to treat. And for the far majority of children, they do well. But that's not to say that we want to see more kids with MIS-C. I think the things that we're doing to contain COVID also are benefiting kids, masking and getting vaccinated.
Yes, that's a wonderful answer. Thank you so much, Lou. So we have a question from Facebook, and I'll first turn it over to our school psychologist, and then I'll turn it over to Lou to answer. This is from Emerlyn. She says, my daughter is fully vaccinated, but I'm still not comfortable about her going back. And when she says back, she means to school. Am I wrong for not entertaining in-person school? So again, I'll ask our school psychologist to first answer, and then we'll turn it to you, Lou.
I would say no. I think it's important for you to do what you feel most comfortable with your family. I would say, though, that if you do choose not to send her back in person to school, that you make sure as much as possible to have a routine for your daughter where she's getting out of the house in different ways. So if that's waking up in the morning and going for a walk before she starts her school day, or making sure that after the school day, she has some time outside, I think those things are really important for the mind and even for the body. So you must do what feels most comfortable and safe for your family so that you can sleep comfortably at night. But you want to also have that routine for her to keep her active and in that mode of we get up, we go out, and we do every day. I would think that would be really helpful.
Yeah, absolutely concur. I think also too, it's important to make sure that there's a sense of academic enrichment for your daughter, for you to be able to see what the curriculum looks like, and even to just sort of supplement that with any sort of books that you have at home, any instruments, any sort of math material, anything that you could do to sort of supplement your child's learning outside of the remote hours. I think that would be really beneficial, in addition to stretching and making sure that we're taking care of the body as well.
And if I could just add, I don't know the age of your child, but having a conversation with them about what you're thinking and why, I think can be really helpful, because your daughter may be eager to go back, or maybe she's also fearful. But I think at any age, it's important to keep the communication open so that they know where you're coming from and why, and that you can kind of hear them out, because you never know. She may change your mind or open you up to something that you weren't realizing is really important to her, or how she may be feeling about the situation. So no matter what you end up doing, I would say hopefully you can have a conversation with your child when you're making that decision.
Wow, I so completely agree with my colleagues here. The thing I hate about some of my colleagues in medicine is that we tend to do a lot of this, and we tend to give universal, one-size-fits-all statements about absolutely all kids should go back to school and everyone should get vaccinated. There's no decision other way. There's, of course, context. There needs to be personalized recommendations based on your unique circumstances. And really, a physician's job, the word doctor is Latin, docere, which means to teach. We are teachers. We should be giving all of the information as much as we know it, and allowing you, empowering you with the knowledge that we have, that we've gleaned, and allowing you to make the most informed decision what's best for your family. So I completely agree with my colleagues. I think the idea of, when we talk about efficacy of vaccines, people say, that the Pfizer vaccine, it's not that 95% rate efficacy, it might be even lower. But it depends what we're looking for. Are we looking for symptomatic COVID? Are we looking for testing and asymptomatic COVID? Are we looking at hospitalization? Are we looking at death? Because if we're looking at those latter two, hospitalization and death, Vaccines are extremely effective. Some of the most effective vaccines, we're talking like measles, polio, things we don't see anymore. If we looked at the efficacy in terms of those who are getting really sick in the ICU from after being COVID vaccinated or vaccinated against COVID, we're talking about a much smaller percentage of those who are being admitted to the hospital, anywhere in that 10 to 5%. So the majority of patients that we're taking care of in the hospital, both adults and kids, are those who are unvaccinated from COVID. So while you are definitely right to be concerned about your daughter, that's 100% you should be concerned. If you were unconcerned, that would be concerning. You know, it's exactly what I want you to be thinking and to be having that kind of questioning mindset. But you have to understand that after being vaccinated, you've taken the most serious risks off the table, at least for your daughter personally, and for all those who are vaccinated around her. But you need to have that conversation with your family, given your circumstances, with your pediatrician, and obviously, you know, with your school district, your teachers, and others that you trust in your community, because there is no one right size for all. But it's 100% real to be worried about it. You know, I'd be lying to you if I wasn't scared to go to work every day, at least last year. But obviously, we've gotten a little used to it. Now it's a little more routine. But, you know, it's masks work, vaccines work, but you have 100%, you know, it's very understandable that you still have concerns.
Thank you. And I also want to piggyback on what Janaea spoke about earlier. I love that she said, have the conversation with the kids, because I think sometimes parents tend to forget that kids have a mind of their own, even me. Sometimes, like, you know, coming from the Caribbean, it's like parents like to tell the children what to do instead of advising, having a conversation. So this question is for the school psychologist. What can parents do to help ease the anxiety and mental health issues that children might be experiencing with having to go back to school and the fear of missing out for those whose parents might not be sending them to school?
That's a great question. I think very much what Janaea was saying before, communication really is the fallback law. I think when we reflect on COVID and just how much it's really affected our society, specifically within, you know, talking about our communities, it really raises a question of, are we having conversations with our children? Are we having conversations with our family members? You know, I think, you know, reflecting back on my own, you know, experience of when COVID first came about, it was like I was actually talking to my family again about, you know, this is really scary. And I know a lot of times it's important for us to face a world that, you know, looks down upon us with racism and systemic racism. You know, it's easy to sort of put on the iron, you know, the how do you put that? I'm sorry. You know, you have your cape on, you know, you have your cape and you're a superhero at all times. But I think one thing that's important for us is to remember that, you know, we have a community behind us more often than not. It's important, especially for young children, to be able to sit down and have those conversations about how you're feeling about going into the school year. How are you feeling about if you have to be remote? How do you feel about if you're going back in the building? I think that's really a great basis for it, because it takes away from the child's sense of, I can't bring this up to my parent without it turning into a situation of there being a high level of conflict or a discussion about, I need you to do this just because I'm asking you to. I think it's a really perfect opportunity for us to reflect more on the child's mind.
Yeah, I would agree. And, you know, not to sound repetitive, but that conversation in my mind is so important, keeping that dialogue open. And I would also say, just to add to that, I think, you know, COVID really has isolated us. It brought us all inside and made us all kind of be on our own, but making sure that we remind ourselves we're not alone. You know, the way we interact with each other may be different, but we're not at the end of the day alone. So, you know, having someone to talk to, whether that be, you know, maybe now you're speaking with your family more, or you have a close friend, or you have a counselor, a therapist, someone that you can kind of reach out with and kind of say what's going on in your mind, I think is really important. And then also, I think one of the things for me was finding something special about each day. And I know that kind of sounds funny, but in a sense, when we would go out every day to work, you know, you don't know what's going to happen. You don't know who you're going to meet, who you're going to have a conversation with. And I think that's what it's exciting for kids. They're ready to go to school. They're ready to meet their friends. They're very social. So they have so much to look forward to. But when we stay inside, a little bit of that is taken away because we're seeing each other virtually. So is there something as a parent, if I'm not going to be sending my child out every day, that I can add to their everyday to kind of, you know, make it not so mundane and boring, and I know it's going to be the same thing. So I think if you personally feel uncomfortable with that, going back in person, finding ways to make your everyday exciting or not so, tedious. But there's some enjoyment to that, can kind of ease the mind and help us, go along with each day.
Thank you, Janaea and Marlon. And I just want to shift a little bit to vaccines that everyone is kind of talking about right now. And Emily mentioned that her daughter has seizures, and she also has a heart murmur. So she's kind of like afraid of sending her daughter to school. And even though she's fully vaccinated, she has some comorbidities or extra side conditions. So Lou, how do vaccines work in children? And this is like a 4-part question, so I'll ask it one at a time. How do vaccines work in children, and what are the possible side effects?
Perfect. No, and I want to make sure that, we contextualize the advice I'll be giving here. This is going to be more blanket statements, and everybody's personalized medical history and family history needs to be tailored to them by their own pediatrician or their own doctor. So what I'm telling you right now is going to be more of that universal statements about how vaccines work in average from our understanding of mRNA vaccines. But in terms of your kid's specific, medical conditions or medical history, that has to be a conversation with the doctor that cares for your kid. So in terms of how vaccines work in children, they work the exact same way they work in adults. We take some sugar, some salt, and some fat cells, and we kind of make a little cell that we wrap a piece of a non-toxic, a non-lethal part of the virus that is responsible for making kind of the hat that it wears, that spike protein that allows it to enter into cells. It uses that kind of spike protein as almost like a sticky key so that it can find a cell and kind of stick onto it and get access in. So we actually take a little bit of that blueprint, the RNA that's responsible for making that really by itself harmless kind of key. And then we actually, wrap it in. It's literally, there's no preservatives. It's sugar, it's salt, it's fat, and then it's that little piece of the blueprint or the mRNA. We put that in a vaccine. Your body takes it up. And your body recognizes it and goes, this isn't ours. We didn't make this. It's not really supposed to be here. Let me go and show my rest of my friends who work for their immune system what this thing is supposed to be. And your immune system goes, wait a second, let me actually gobble that thing up. That's not supposed to be us. That piece of mRNA then goes into those immune cells that really have short lifespans, and their job is to find viruses or find foreign particles, eat them up, and then go away. It takes it up, and then actually that piece of mRNA is used by that immune cell to then actually make copies of that, that key, which by itself doesn't do anything. It's just the blueprint for a key that without the virus behind it, it's really just a key that's opening a door with nothing that's coming in. But then your body's used to seeing that key. So that if it ever does see COVID-19 virus, maybe weeks, months, a year later, we don't know how long vaccines last. And that's going to be a question about boosters that we're all going to be learning as more evidence comes out soon. But when your body sees the real virus, your body's like, I already got this. I've already seen that key. I know exactly what to do. I know all my friends. I know where they're hanging, and I'm going to bring them right to fight this thing off. So it's one of the most, we've had mRNA vaccines since the late 80s. This is not a new thing. People want to say, I can't believe they made something brand new in a year. This is stuff that we've been testing for 30 years that has a lot of vetted. We just never had a big pandemic like this that needed us to change the way we make vaccines. It costs a lot of money for companies to make vaccines. So if it wasn't for the US government and the European Union government giving a lot of money to these companies to be able to make that investment just in case it didn't work out, they had to speed up in terms of the production of making lots of these things that we hadn't. But to say that we haven't used mRNA vaccines, we had mRNA vaccines for the flu, for Zika, for HIV. We just never really needed them. And if the Zika virus turned into something that was much worse, we probably would have been using mRNA vaccines back then, but it went away. And I think all of us were just probably like the last administration, hoping it would just go away and it would just, it'd be a beautiful day, it'd go away. Unfortunately, that's fantasy. That wasn't reality. So we had a reason to use these vaccines. So they work just like adults. It's just sugar, salt, fat, and that little blueprint that we call the mRNA. And then your body takes that up, makes copies of that, and then your body knows exactly what to look for if it ever does see the virus again.
Thank you. I could definitely see why you're a pediatrician though, because you explained it like I got it. Like you explained it like you'd be explaining it to a child with the sugar and the salt. It was very, very simplified. It's perhaps the most simplified I've ever heard the vaccine been explained. And so any child who's watching right now will sort of understand like this is how the vaccine works. And so the other question, I'll kind of mix the two together. So for children under 12 who cannot get vaccinated, what precautions should parents be taking? And for children over 12 who can get vaccinated, but the parents still have reservations, what would you say to them?
You know, again, everything is so specific to their own kind of, if you're telling me we live at home with grandma who's, you know, fighting breast cancer and she's on chemotherapy, that's a completely different case than when you say there's nothing but a 35-year-old mother, you know, or father, there's two young, otherwise healthy people that have lower risk, no comorbidities. Those are two completely different contexts. So it's important that we understand each family dynamic is going to be different. And the ability for people, if someone does get sick in that home, how well can we effectively distance? When I lived in Brooklyn, I lived in a 400 square foot apartment. There'd no be a way I'd be able to distance away from my wife. So, you know, it has to be in the context of where you're coming from. But in terms of for kids that are less than 12, thank the heavens, thank the creator, thank God, thank whoever we pray to, that they tend to do a lot better than, let's say, adults on the 65 plus range. So in terms of, you know, what would we do? I would say do the same things that we've all been instructed on doing. There's really not that much new in this regard. Masking it, well, there's not the best evidence to say in kids, it works so much differently than in adults. We know in adults, it tends to stop spreading viruses. So we can have to kind of anticipate that it does the same in kids. But I'd be lying to you if I say, I have evidence-based facts that prove masking children is the only way to stop this, because we didn't just mask, we masked, we separated, we got vaccinated. We did so many things at once. We started washing our hands more. So I don't know what it was, but together it seemed to reduce the risk that kids were getting really sick and ending up in the hospital. So I say for those that are less than 12, there's only reason to believe that masking will help and be beneficial at either reducing their spread if they're asymptomatic or allowing them to get inoculated with droplets. But you know, the real risks are, I know I've taken care of kids who are much younger who have speech delays because we actually learn to talk by seeing lips. So kids aren't seeing lips. So they're actually having a harder time learning to speak. So it's not that masks are risk-free by any means, but just like getting in the car, it's the risks and the benefits. And, you know, the idea of continuing our education, continuing our socialization, those are real benefits that might be mitigated by, you know, the risk of maybe getting a little acne or maybe, you know, being, you know, 3 months behind in your speech when you're a younger kid, because we can catch that up really quick. But if schools stay closed forever, the setback that's going to cause the children is going to be much worse. For those over than 12, if it were my children, I would get them vaccinated if they didn't have contraindications, if they didn't prove that they were allergic after the first dose to get the second dose. But that's me, and that's me personally. It has to be a decision based on you and your family and all of the information we know that vaccines are safe, vaccines are effective against hospitalization and death, and that vaccines are the quickest way that this thing will be behind us.
Okay. I have two quick questions about vaccines that came across in the chat. One of our viewers wants to know if, number one, do vaccines cause people to become sterile? And number two, can you comment on the need for getting a booster shot? So I'll turn it over to you, Doctor.
So in terms of causing to be sterile, unfortunately, that is I just haven't found any valid evidence. I hate to say it, but that sounds a lot like fake news. There's just nothing that's been reproduced in any amount to prove that point. Like, it's possible that at night the sky turns purple, but like, since none of us have a light to see the sky at night, we have to assume it's the same blue sky, it's just without light. Like, when people make those claims without evidence, just to potentially cause up, you know, more concern, or to potentially, maybe they have an own agenda, but there's just no evidence that it causes, that it affects the placenta, that it causes, any kind of infertility or sterility. There's no evidence to that fact. So, you know, it's possible that, you know, a spaghetti monster, you know, is outside my house at 4 a.m. in the morning every day. And I hate to be so facetious, but like, anything is possible. Yes, I can't say, 100% no, but like, there's no evidence that it does. And we can't live in a world where we just, you know, entertain every possible hypothetical. We have to have some reason, and we have to accept what we know, move forward, be humbled by the fact that things might change. So we have to stay dynamic, but there's no evidence that it causes infertility or sterility, none whatsoever, that is reproduced in any type of valid or verified study.
And then can you answer the second question about the booster, the need to get a vaccine booster shot?
Yeah.
Out from the CDC, of course.
And this one kills me because, you know, in this as a director of health equity, as much as I worry about Americans staying well, I also think about the world. And as we all know, the Delta variant didn't start in America. It started in another part of the world. So if we simply focus on giving us all boosters and keeping all of our vaccines here, some other part of the world is going to have a new variant because they're not even getting their first rounds. So this is a personal opinion I have on this. Well, I do think at some point, just like other vaccines, we only have a year plus of testing this vaccine. So we really don't know. And by a year plus, I mean, this was, when did I get vaccinated? In December of 2020. So, we don't even have a full year. Time will tell. It stands to reason that some studies are showing that the immunity does wane, that natural infection might not be as strong as vaccination, but we're still kind of figuring this stuff out. But the idea is that potentially we'll need a booster, and that'll give us more long-lasting immunization or protection from the virus. But in terms of, I do think there will come up opportunity for us to, obviously America has resources. We're the richest nation in the world. So yes, we can all have the access to get boosters, but we still have 50% of our public who didn't want the first shot. So if we focus on everybody else getting their third shot, we're losing behind because the virus is just going to spread amongst the other 50%. So we're right back where we started. And yes, we'll make our risk of going to the hospital from 1% to less than 1%, but it's a still very small risk. We'd probably be better off vaccinating the rest of the world, people who would line up for days to get their first dose in other parts of the world, as opposed to, but that's me getting off my soapbox now. I do think it's going to be important. I will be the first in line to get my vaccine, probably with a lot of my colleagues who have been on the front lines seeing this, taking care of family members and loved ones of people. And none of us want this. None of us want to go through this. And we've all on this call been affected by COVID-19 in some way or the other. From my experience, from my heart, I would be the first to line up, as with my wife, as with all the colleagues that I work with, that we talk about this. So, there might come a day where we need a vaccine this fall or into the spring of next year.
Thank you so much for that answer. Yes. Okay, so now I have another question. I'm going to turn this first to our side Ds, and then Dr. Hart, if you want to comment. Someone in the audience says, as a community health nurse in Staten Island, a borough that has some of the highest rates of COVID in the city, please give me some tools on educating parents regarding the importance of getting the vaccine. Are there any brochures or books that you can recommend? And this is also somebody who's working in our community in Staten Island. So a lot of people don't realize that there are people that look like us that live in Staten Island, but we're there.
Janae, not to put you on the spot, I know you are a former Staten Island resident, so.
Yes, I am from Staten Island, born and raised. But I would say, though, that one of the things that I try to do is I make sure that I stay up to date with my National School Psychologist Organization to see what their recommendations are. Because I know they're following the CDC to see what kind of guidelines that we should be following, what's the newest and most recent information. So I would say to start there with your national organizations. But then if you have children in a school, you can also reach out to the school psychologist, the school counselor there, and they should have resources and pamphlets that they can give out to you to keep you and your community informed as well.
Yeah, I think just to emphasize the point, now more than ever, there is such an urgency to stick with the facts and the information of what we know, because there are a lot of people, unfortunately, that have been misinformed of no fault of themselves, or if there is a situation where someone is following fake news, whatever the case may be, misinformation is spreading. And I think, the role for school psychologists, one thing that we always follow is the facts. We use data to support any decision that we make in terms of whether it's giving a kid additional counseling, less counseling, to provide an IEP for them, to remove services for them. Anything that we do, we follow data and factual evidence. And I just, just to emphasize Janae's point, follow what your national organization is saying and what the school districts are saying and everything like that. And just to emphasize, I found that it always helped for me whenever I was consulting with teachers in schools. Whenever I provided and cited data and evidence, it showed that it came from a credible source and it wasn't just my legs to stand on a personal issue. So me saying, no, like science shows X, Y, and Z, I found that I got a lot more feedback, and the other individual was able to say, okay, I never really thought about that. Let me consider that. So I think it's always important whenever you do reach out to parents and families to just, have those citations, provide those resources. I wish that I could have provided any sort of brochures or information like that to you. I'm sorry about that.
One of the sites that I can think of off the top of my mind that I remember using throughout the school year was the Child Mind Institute, I believe it is. And it's just a website that I found had family-friendly information. So it was presented in a way that I could understand and that the children that I work with understand. I specifically work in elementary school currently. So I just found that that specific research for myself was very helpful in helping children understand some of these kind of conversations, adult conversations that we're having. So that's one I can think of off the top of my head if you wanted to look it up. But like Marlon said, I'm sorry, I don't have something to give right now.
Yeah, I mean, I've used so many back and forth as we were in New York City, kind of thinking of what was the best messaging and what was the best way to structure this content, how to deliver it to such a diverse population like we have in New York City with so many different cultural backgrounds, even amongst people who look like us, who are from different parts of different countries and different parts of the world. So it's, again, it's hard to give you one source. But I do love the idea of really sticking with what is reproduced. What is, science is something that you can reproduce multiple times over. And the beauty about science is that we should be the ultimate ones to say, when we find something better, we have to move to it. Like we're always challenging ourselves. So the goalposts are a little bit moving, which can be frustrating. And that makes sense. Like, why did things change? Well, because we learn more, and that's, if we got stuck in our way, that would be belief. That wouldn't be science. And facts do change when it comes to as brand new things, as we learn more about the virus and more about what works. So, when you're reading stuff and, as much as I can agree so much with Marlon's point, misinformation really is a pandemic. There's so much out there about people on Twitter, on Facebook, on op-eds that are literally, it's a free country, so anyone can write anything and write an editorial in the Wall Street Journal about how masks increase CO2 levels and that's causing cranial deformities and brain defects. And then you ask, like, where did you get any of this evidence? Well, there was a study. Well, where is the study? Well, I found it. Well, when people start giving you that kind of answer on where they found this stuff, maybe that spidey sense needs to tingle a little bit and be like, has there been other studies that found what that one found? Or is that just kind of how that one person feels? Not saying they're wrong. I'm just saying it's hard to say that you're right if no one else can also see the same thing that you're seeing. So it's all just about reproducing. And I do have some content. I'm going to find it in the background. I have it on my computer here, the link, and I'm going to share it in the group, and then potentially my colleagues here can share it with you. But this is from the American Lung Association. It was kind of like a COVID vaccine toolkit, but it was made for diverse communities. So from certain Latin American cultures, Black communities in America, but it's even hard to say the Black community. There's no one Black community in America. I mean, there's so many different communities. You're in the Northeast, you're up in San Francisco in the Bay, you're in Alabama, or you're in New Haven, Connecticut with me. It's many different communities. So hard to have one blanket approach, but I can share some content that I thought was pretty good. But try to stick with things that have multiple sources that are validating it, that aren't just on social media or that aren't just on the first thing that comes up on Google.
Thank you very much. And that's something we try to do at Dr. Myers and I in our work. We design a lot of culturally tailored interventions that specifically targeted around that. Because what might work for an African American might not necessarily work for an Afro-Caribbean. And what might work for Afro-Caribbean first generation might not work for Afro-Caribbean second generation. So there's a lot going on here. And we kind of I remember once we are currently doing a culturally tailored intervention around diabetes. And one of the feedback that we got back when we were designing the intervention was that a lot of interventions are very whitewashed or white-based. We are telling Hispanic individuals to eat healthier, but we're saying eat pasta. The Hispanic population does not eat pasta. If we're talking about diabetes, which is more Dr. Myers' expertise, Black people or Caribbean people would refer to it as sugar as opposed to, diabetes. So you have to tailor. And another thing is you cannot tell Black people to fast. They'll be like, why are you telling me to fast? I want to eat or don't eat certain food. So there's so much going on. And this conversation is so, I wish we could always continue for a lot longer, but it is so short in the hour. And so before we end, I just want to ask one question. We've been focusing so much on the children, but we didn't talk a lot about the parents. And as Emmeline said, she is worried about her children. And I know that there are so many other parents on the call right now who are worried about the children. So what should parents be doing now to take care of the mental and physical health as they're getting ready to prepare the children to go back to school, or they feel very anxious about what's to come in the fall semester or the fall months?
It's so important. I think one thing that sometimes can be fleeting for all of us is to go back to the toolkit. And I know self-care could be a buzzword, and there's a lot of different associations to, like, you know, treating yourself and shopping. And granted, if that's a part of your self-care kit, by all means, go for it. I just think definitely to take a far more eclectic approach to what self-care means. Where physically, you know, are you taking care of yourself? Are you eating right? Are you sleeping correctly? Is your sleep hygiene tight? Are you, you know, getting into some physical exercise of some sort, even if it's not just the gym, just going out for a walk and being able to clear your mind? Are you getting into any sort of hobbies and things that just take you away from, because, you know, at the end of the reality of the situation is parents also are working too, chances are, right? So you're not only concerning yourself about your child's well-being and how it pertains to COVID, but your employment and how it pertains to COVID. I think it's really important to go back into the toolkit and to ask yourself, what are the things that kind of revitalize me as a human being? Where do I feel spiritually aligned? Do you feel like church is a good option for you to be able to praise and find energy within that? Or do you find more of a spiritual aspect of it where it's not necessarily based off of a religion, but just like a toolkit, maybe coming up with, I would say, you know, 5 to 10 things. Doesn't have to be something that you do all the time, every time, but just something that you could pull out each time to remind yourself that you're a human being going through a time that none of us could even expect to even consider this happening in our lifetime. And, you know, every single month we feel like we're over it. And if we get some sort of news that reminds us, the reality is we still have to go through a little bit more. So I think it's really important to just consider that toolkit for yourself personally and your family too.
Yeah, I would agree with Marlon 100%, making sure that you are taking care of yourself so you have the energy to kind of be there for your family in whatever way they may need you. I would also say, though, that, you know, staying informed as possible, keeping open communication with your child's school so that whatever information that they're sending out, you're aware of, and you don't feel at the last minute rushed or that you didn't know, because I know that can add a lot of stress and anxiety. And then delivering that to your child, whatever decision you're making, kind of like we've been saying earlier, having that conversation. And I would also say having that trust. I know this is very scary times, but having the trust in your child that, you know, you have raised them well, you put a good head on their shoulders, and that they are, you know, going to go out there and do what they need to do. You would be surprised. I was in this summer, I worked in the kindergarten, transitioning to kindergarten. So these are preschoolers going into kindergarten, and they were like, oh, you got to put your mask on. Oh, no hugs. We have to stay apart. And they knew what the rules were and they were following them. So I would say, I know it's very scary. And, you know, when we see them at home, they're sitting on the couch and they won't pick up their clothes and put it in the hamper. But when they get into the school building, you'd be surprised. They are following the rules. So have the conversations with them so that they know what they need to do to keep themselves safe, and then trust that, let go just a little bit and trust that they will. And that may hopefully ease your mind to feel more comfortable with these scary times.
Yeah, undoubtedly. This is the worst time of probably most, if not all, of our lives. But the benefit, and I strongly believe this is not going to be forever. But you know, the longer that we kind of remain so inconsistent and we kind of half open, half closed, the longer this thing will kind of last. So it's something that it's going to take all of us to hold each other responsible and to hold ourselves personally responsible. You know, I didn't get vaccinated for myself. I was, you know, what was I? I'm 33 years old now. I'm in decent health. I have no comorbid conditions. I got vaccinated so I didn't spread it to people that looked like you and me, that I didn't spread it to my patients, that I didn't give it to babies. I did it for others. So every year people are like, why do you get your flu shot? It's because the doctors, it's because your hospital makes you. I'm like, no, I can wear a mask. I always could have worn a mask last year. I get the flu shot, not because I'm afraid of getting the flu. It's because I'm afraid of spreading it to somebody else, a baby, a grandma, someone who's more susceptible. So I've always done this for other people. Maybe it's because I grew up in Canada and I grew up with civic responsibility. You do for others, but that's something that we have in our community. So it's something that we have to think about with an open mind, why we're doing this. We're doing it for each other. Don't always think about ourselves. And, you know, I know it's the American ideal to be selfish and only worry about ourselves, but we have to often think about what, you know, we're all in this together. And this thing is not going to go away. If 99% of us do it and only 1% does it, there's still going to be remnants of it. So we have to do it for each other. And the quicker we can kind of understand that we're all in this together, that this is, even though it's hurt some communities more, this is the ultimate equalizer because it will affect all of us ongoing, even if it affects only some of us. The quicker we realize we're all in this together is the quicker that we'll probably emerge as a much stronger and a better nation, but we'll put COVID behind us.
Thank you so much. This show, I can't believe the hour. I don't know where it went, Dr. Williams, but I feel like I just logged on 5 minutes ago, and y'all's energy was amazing. So I would like to thank you so much, Janaya, Marlon, Lou. There was a lot of great food for thought. Obviously, we can't convince everyone to take the vaccine, but I think the way that Lou broke it down, somebody commented on Facebook, even my kids now understand what an mRNA vaccine is and how it works. So thank you, Lou. I was just waiting for you to give me a lollipop. Like, I just felt like you were just like the greatest pediatrician. So
pediatrician.
Yes. I was like, do you have a dum dum or a blow pop? I just felt like you were going to give us candy afterwards, because you just really, I can tell you really have an knack for children. And Marlon and Janaya, I can feel that you guys are great psychologists in your community, budding PsyDs, and I'm just proud of you. You know, as someone who's a little bit older than y'all, I'm proud to see all y'all thriving. I love all this Black excellence here. You know, we have to keep wearing these masks. I know it's annoying. I actually have gone back to double masking because I'm just really not trying to get this Delta variant. We have to stay safe. Whether you want to get vaccinated or not, you still need to wear your mask indoors and outdoors. And it's important that we be flexible with our jobs, flexible with our schools, because this is an ever-changing environment. 1 minute they're saying you have to go back to work. Next minute they're saying no, stay home. 1 minute the schools are open, 1 minute they're closed. This is now a part of life. When this will end, we don't know. So our new normalcy is, like Janaya said, be flexible. And we have to be concerned about our children, because if they are staying home, we need to make sure that they're getting some social interaction and some social support. So we need to break the monotony of just sitting at the computer. I even tell my adult patients that you can't just sit at a computer every day. If you can keep your camera off, go for a walk during one of your meetings. You need that outside interaction. And I find that people who are isolating, unless if they have that type of personality, because there are some people who like to isolate, don't get me wrong, but if that's not your personality, it's very hard for you to cope. So it's important that we do have some sort of social interaction beyond just being on Zoom. And I just want to end by showing you our next show. I'm really excited. It's something that's near and dear to me. We're actually going to be focusing on transplantation. So we're going to have a couple of folks who've actually successfully had transplants, as well as a transplant surgeon, as well as a doctor who focuses on transplant solely. So our next show is coming up. And then this is also from Dr. Lou. This is a webpage that you can look at if you have some questions about vaccines. And here's the flyer for our next show, which will be September 9th, where we'll have Doctors Ernesto Momenti and Kevin Shaw. Dr. Momenti is one of our kidney transplant surgeons, and Dr. Shaw is a cardio transplant support doc. He's on the cardiology side of things. And we have two esteemed guests who are both transplant recipients, Ms. Shaniqua Brown, as well as Mr. Ebert Mahon. So same time, same place, 8 o'clock. You'll see us here on Facebook. Here's the code. And we're sponsored by GP Cleaners, that does a wonderful job for flooring right here in Brooklyn, New York. On behalf of Dr. Williams and I, we look forward to seeing you again on September 9th. Thank you so much for joining us tonight. And thanks again to our panel. Good night, everyone.
Thank you.
Thank you. Bye, everyone.
Thank you.